what informed consent would be to the person that's going to receive this vaccine? Are they fully informed?
It's up to each individual person how much research they do.
Okay, so it depends on them to research.
The information is available.
Okay.
Well, when you say available, I want to clarify, because there's a form that you can print out from HHSA. It's a one-page questionnaire. I have it in my bag somewhere. But
Right, the one that has...
Yeah, you answer a few questions, yes, no, not sure.
That they have to bring with them.
Yep.
Yep.
Download that. And there's something new that I noticed.
Mm-hmm.
At the near bottom, it says something to the effect of when available. These sheets have to be provided. Even though they're not thorough, and they omit, and they dilute, these have to be given. And we've been giving these away every time we show up. People say, no, I never got it. So if you run out, you don't have informed consent. And if they don't know how to read, you have to ask, and somebody has to read it to them. And if it's not in their language, you have to have another language for them. You understand?
Yes.
Okay, so these are very serious omissions of informed consent. Just because someone drives up, rolls up their sleeve, and presents, that's consent, but it's not informed consent.
Right. You know, what concerns me, though, the most is how the informed consent issue is being pushed onto the recipient. That the responsibility is no longer on the physician, but it's on the recipient. So it's up to them to be informing themselves rather than whoever's giving them this vaccine and telling them all the risks and side effects that could go with it.
The information is all made available.
Yes, but
people, it's dependent on.
But that's how the responsibility has shifted. It's shifted from the healthcare provider and gone to the recipient. I mean, isn't there an issue there? Isn't that I think that's a very, very problematic. That's very problematic. I can't get over that. Like, seriously, that's where we're at. Okay, so we got information at our fingertips, but not everybody knows how to operate these devices. They don't know how to access this information, and so they really do trust.
Or they don't have access.
Right, they have absolute trust in the healthcare provider that they're not hiding anything, and this is literally hiding things in cyberspace and expecting the recipient to be able to go in and find it on their own. My question is: are the recipients clearly instructed to go to VAERS if someone were to die because of this vaccine?
We instruct anybody who has an adverse reaction to report it to VAERS.
Okay, so if the person doesn't have anybody to report their death, how can we be 100% certain that their death will be reported?
We're dependent on the public to be able to do their adverse reaction reporting. And the CDC, that's again another question for the CDC.
Because as I'm reading through these descriptions, it seems like there's an agenda here.
That sheet does not have death on it.
I am not a doctor, so I can't answer.
You don't need to be a
questions,
doctor. You don't need to be a doctor.
What I can tell you is that what I have heard Dr. Ramstrom say is that death is not a side effect of this.
Yeah, I captured that as well as many others on the media breaching hybrid that was done this past Wednesday, the 24th. Yeah, a death is there, and it is a fact.
So when we do vaccine clinics and when other providers do vaccine clinics, there's information that we have to provide to people who the vaccine. We have to offer it to them, we have to make it available, and we do that, and they receive the information, and they then know, and they're welcome to do other research in advance if they'd like to, but they have been informed of what the risks and benefits are of the vaccine that they're receiving, and they consent to receive the vaccine.
Yeah, specific to this, there's information that's been provided by the vaccine manufacturer that we're required to give folks. And I'd remind everyone, the other piece of this is the emergency use authorization. So we also require that folks understand that this is under an emergency use authorization.
Since anyone can report to VAERS, are the reports on VAERS biased?
Good question, thank you.
So my understanding is that providers can report to VAERS, and then people who have received the vaccine can report through VSafe if they experience any adverse events after receiving the vaccine. So in terms of bias, I mean, I suppose for the individuals receiving the vaccine, there could be some difference in the people who choose to enroll in the program compared to those who do not. But if they go and see a provider and the provider then reports it into VAERS, it should still be included in the data.
Since a vaccine can cause anaphylaxis, can anaphylaxis cause death?
Yes.
We are outpatient, the written, I would just say yes if it's not treated appropriately and rapidly, which is why we have people monitoring people after they've received the vaccine, and we have supplies such as EpiPens on hand in case that were to happen.
If anaphylaxis was caused by the vaccine and death resulted, what would be reported as the cause of death?
I think anaphylaxis would be reported as the cause of death would be under the COVID vaccine, and it would be reported as such.
Just want to repeat again, I think I've said this before in public meetings, that the death certificates that are recorded in California, they are filled out by the attending physicians or the patients. The death certificates are not filled out by anyone at the public health department. And the only exception to that is if it's a coroner's case, in which case it's filled out by the medical examiner who is a government employee. But that person is employed with the sheriff's office. So the death certificate, all the death questions, I think it's important to understand that the cause of death is determined by the attending physician, and that is what gets recorded into the death data.
What's the worst that could happen, like side effect wise?
Side effects wise, I mean, like you feel like a little hot, but kind of feverish, low grade. I wouldn't say like 102. It's more like 99-ish. Tenderness. So you would get like almost like you feel like you have a cold coming on. That's just your body ramping up the immune response. So if you see that, you know at least you're building some kind of response.
Okay.
So this has no actual virus, live virus. So you can't get sick from it. What you're feeling is your immune response ramping up.